all in the team. Good evening, good afternoon, and good morning. This is the 1999th day of continuous webinar conducted by International Forum for Promoting Homeopathy. We are celebrating our 2000 day tomorrow. Hope all of you will join us tomorrow. And now I am inviting Dr. Miss Arya to moderate the English session.
Sir, am I audible?
Yes.
Welcome everyone to the 1999th episode of the Uninterrupted webinar series of the International Forum for Promoting Homeopathy. I'm Arya. I'm a third-year student from ANSS Homeopathic Medical College, Kottayam, Kerala, and I'll be your moderator today. So today is a very special day for us because we are about just hours before we achieve the historic landmark of 2000 uninterrupted days of webinar series. Without any delay, without being fatigued, without having any tension, we have completed 2000 days of uninterrupted. That's the highlight, uninterrupted days of webinar. And it's really an occasion of celebration. Actually, we must, in this platform where we unite all the teachers, practitioners, students, and well-wishers of homeopathy from across the world to an international level. So now let's, before making any delay, let's moving to the topic. So today we will be having a discussion on a very relevant topic, especially for us students, whether we are producing doctors or just merely degree holders. And in the current world where competency, clarity, and confidence matters, even for a homeopathic physician, the bridging the gap, that's the need for finishing schools in homeopathy, is actually something to have a great and long discussion about. So first of all, I'd like to invite Dr. V. Karunakar. He is a medical officer practicing in the government sector, and we'd like to hear from you, sir.
Yeah. Good evening to all. First of all, I have expressed my hearts up to you, IFPH members, because of it's a very impossible to anyone to have been continue this type of continuous sessions, and definitely the maintenance of time and schedule and different people united to come back, brought into one platform. This is a very fortunate thing to our homeopaths and very, very happiest thing. So I have to express myself related to topic.
Sir, can you adjust your camera a little more? Yes, no, it's quite okay. It's fine. You can.
Yeah, okay. So bridging the gap. First of all, I have expressed myself. There is no gap, but we have created the gap everywhere. Why? Because 2 more days we have to listen different people. They have expressed their own opinions and the lacunas in different levels and how to construct or to fulfill those lacunas and to create efficient doctors into the public. Yes, original topic, either doctors are provided from the institutions or degree holders are provided from the institution. If you have asked to me, there is a 50-50 chances. A few people are just, they have a degree, they are not interesting to practice. And few are more interested and they have started practice, but they are not reach their goals and they have developed some amount of depression and they turn into some other fields and going to back. For this, so many reasons are there. I have to discuss. And another thing is why, what is the reason for that one? So there are so many reasons are there. Everyone expert. The first and foremost reason is their student mindset is before joining into the course, they are under the depression. I missed MBBS seat. They don't know the BHMS is similar to the MBBS. We have reach, we have success more in this course, all other things. Their mindset is like that. they are mechanically habituated and they are entered into the field. Again, there is a flame, we are pouring into the some amount of air and kerosene into the flame, this is flare up. So like that, the institutional situations are again creating, they have been continued depressive mode. They are not having developing interest towards the studies. They are mechanically by-hearted and they try to, everyone try to get the pass marks like that. So first of all, the students has to remove the type of concept. So homeopathy is also a good scientific course. It is equivalent to MBBS and we have succeeded. We are served to the sick humanity. So when this concept keep in their mind, they are started showing interest towards that one. Another factor, the creating depression in the student's mind is the environmental conditions of the institutions. That means once we have to see the MBBS colleges or some other even nursing colleges, compare with them, our colleges are comparatively less. That means even somewhere there are facilities are there, but we are not in a position to use. And also what I have observed in the institutions, so the lacking of facilities in somewhere and in some places, there are so many facilities, but we are not useful. So we are not use those available conditions for developing our knowledge or enhancing our knowledge. Similarly, we are coming to the hospital side, clinical side, we are not exposed to, so everyone, they are maintained records, the false statistics will be maintained. After seeing the students, they are habituated. This is the technique how we are escaping from our duties. So that's why their mind concept is always in every level developing. So not towards the scientific construction of our system, and they are damaging to the system of medicine. Again, there are so many doubts in the minds of the student. That means regarding diagnosis, regarding miasm, regarding which book is a complete one, either which mathematics is good, which repertoire is good, and everyone has individual. Everyone has used their individual concept in individual manner, not the scientific principle. And we are, as a teacher, what is the teacher? These are the lacunas in the students. And even though they have ability, they are not brought into the surface. So that's why again there. And also even from the first PHMS to even PG, I asked one question, everyone, homeopathy is a symptomatic treatment or not? Out of 100 students, 90 students were answer yes, homeopathy is a symptomatic treatment. But really homeopathy is not a symptomatic treatment. All other medical professions are symptomatic treatment. And again, they have seen a repertory somewhere. There are so many, we are, as it come to the teacher point of view, they are also in government institutions and private institutions. In the private institutions, what is the problem? The salary is the problem. So, and also competition is more. A few people are working under less salary. They are even demanding you. They are removing from the institutions. So that's why some people are, even though they are enthusiastic to teach the subject, they are mechanization and they are not showing their talents to teach the students all other things. Even the teachers are also mechanically habituated to show this is the case taking, this is like that. They are not showing clarity what we have read in the textbooks, what we have teach. They are practically fails to show to the students. Students are again developing some amount of depression. It is a false sign. There is no worthful science like that. Many times I teach to my students, so don't depress, be confident. So Hahnemann clearly stated, he was estimated earlier. So my principles are unable to misunderstanding, misuses, misinterpretation. In the Stuart Plus philosophy, he was used mutilated homeopathy or impotent homeopathy. So that means the wrongly application of the principles, wrong interpretation of the principle like that. Even few teachers are there, they want to teach according to their eligibility, the remaining people, because of selfishness, because of some other reasons, everybody tries to get back. So this was observed in the institution to pulling get back, not thrown forward direction to promote the system, but they are pulling back. Again, they want to have some sort of depression. And here lacking of practical oriented. So some people are saying that there is no need of diagnosis. Some people are saying there is a need of diagnosis. How the students are clarify them? Is it need a diagnosis? Is it no need a diagnosis? Here again, that one. and what type of cases were admitted in that one. There is a clear-cut criteria is there for admission of the patient in the IPD, how to take the case in the OPD, but never follows this principle. Again, it creates some amount of doubt in the patient, student's mind. These are all. So even in the norms of NMC or CCH rules, everyone. Here, one more thing is also recently, it is a passionate. Inspectors are come, they are observing, they are noted, everything is like but again within 15 days, 20 days, they have sanctioned the permission. This is also another habituated. In the examination point of view, the students has in their minds, whatever the stories are written on that one, that the examiner, the teacher has given a pass marks. This is the thing. I read one wonderful statement written by a student. So Baker's cyst is there, one question in pathology. So he has written, so the cyst which is prepared in the bakery is called as a Baker's cyst. This is the answer I felt in the textbook. Even whoever correct that paper, he has given 1 mark to that one. So where is the standards? So there are even somewhere one teacher can teach many a subject. Yes, he is eligible really to teach, but how he is justifying to that one? This is another important factor to think of. So these are all different factors creating. Again, come to that. One man said mental symptoms are more important. Where is the mental symptom? Lacking of mental symptoms, what is that one? And another one is most important point, favoritism and selfishness and lack of transparency and lack of trustworthy towards the principles and lack of confidence. These are the factors which are maintained. Even some people are having interest. They are, because of these reasons, forcefully killing and suppression of the talent levels in the institutions. And another one is, so even there, some people are doing some different kinds of approaches to get the pass marks. Every student habituated to that one, the institution, even teacher is also encouraging that one. Still, this process have been continued. We are not providing a doctors from the institutions. We are providing only degree holders. If you see, whoever get the first rank, they are not at all interested in the practice of homeopathy. In the last bench students, they are practicing the homeopathy. And the first rankers are getting the job. Again, they are following what they have learned. It is also another important factor what I have observed. As a student who is sitting in the student chair, he was criticizing the teacher. He is not a right like that. Once he is occupying the teacher chair, he was doing the same mistakes. Without correction of these things, it is very difficult to correct the system of medicine. And another one is, so prejudiced principles everywhere. So Hahnemann clearly stated one on prejudice. So in homeopathic practitioners, in the teaching is also, I am the only king. I am the only person to know the homeopathy, but no one has having knowledge towards like that type of mentality was continuing, and they are not sharing, enhancing the knowledge to other one. So maybe this is also another reason for creating the breach. So another one is, there are different, we are creating the confusions in the students' mind on the institutional wise and teachers wise, or in the public is also. In the public, so many lacunas are there. So one man said there was no treatment to this. I literally received, so either treatment is there or not for obesity. The obesity rubric is there in the Metromedica, repertory and Metromedica. So rubric is there under the generality chapter in Kent or Bogan or whatever the repertory you have taken. Most of the people are said there was no treatment. So many students are come here and ask, sir, there is a treatment for obesity, there is a treatment for angina, there is a treatment for some other like that. So we are unable to clarify their doubts. We are creating more, and we are more focusing, we are more trained the student in the limitations. Where Hahnemann said limitations for cure only there. We are not understanding that one. Limitation is for the cure, not the treatment aspect. So Hahnemann clearly stated that certain cases are cured. Those cases are not cured by the applying a principle of similia. They are palliated. For the palliation is also the principle is similia. So this is, we are not clarifying this. We are not putting this type of effort into the student mind. Student become a lazy and he was escaping the duties. Here, and also one more defect I have observed in the homeopathic aspect, our quite trinity of homeopathy, that means organon, repertory and other. most of the students were going towards the organ of medicine. Even teachers also, they don't know completely. Most of the teachers who teach organ, it is an unfortunate thing to say, to express. They are whatever they in the textbook, they are stated only this thing. So, but not clear concept. Here, Hahnemann was correlated dynamic concept and physical concept, but we are unable to understand how dynamism expressing through physical aspects, and the miasm or diagnosis, prototization or common symptom or uncommon symptoms, and whatever the confirmation of the symptoms, analysis of the case, and other things. Where the symptom is important, how it is qualified, and what are the remedies we have. We are not giving any workshop. We are mechanically saying. But it is, homeopathy is not stolen to anyone. In any other medicine profession, it is very easy to. Once you have learned, there is a paracetamol for fever. But if you are teachers, aconite is a fever. Aconite doesn't work in all cases. In which cases aconite is working, or in which cases it is contraindicated, you have to practice. It is also another important point. So nowadays, everyone is habituated YouTube or some other thing. I asked many times, how many types of case takings are there? He said surgery case taking, anatomy case taking, physiology case taking, like that. Why? Because every teacher has meditated his own way, not. So many times I stated that such different types of case takings are not available. Case taking is a one. To take the case as per scientific principle and logically construct the totality, and you have applied artistically the principle. So don't create already existing things. And anywhere we are failing, we are stated that straightforwardly there was no scope to the homeopathy in this field. How many cases you have treated? Even single case failed, you are succeeded in single case, you are existing. So what we call, yes, homeopathy is the success rate is 100%. Homeopathy is there is no scope, like that. You have to trust it. You have to conduct experiment. Hahnemann was taken more time. Hahnemann was clearly stated, nota bene of revivers is the base for us. He was he was receiving many statements as a criticism, but he never argued. He tried to conduct experiment and clarification. Then he tried to give. Either we are following the same principle, no, we are succeeded, yes, there is a grade. We are not succeeded then. And also what you have in other medical profession, there is a referral system is there. Suppose I failed, I have referred to case some senior physician or like that. Now we observed in homeopathy such type of, no, they are cultivated, so corrupted the minds of the patients and corrupt the minds of the students, only that one. This is also another important point. We have to create bridging. When we are not corrected ourselves, so there is no possibility to fill up the pitch, or otherwise we are fails to provide a qualitative doctors. So similarly, earlier times, the number of doctors are less, but nowadays, the more number of colleges are increasing, and every day the output of the students are number increasing. But why? So here is also, there is another important point is there. So the most of in the institutions of homeopathy, most of the students are girl students. So I have observed comparative sex ratio, male students are less. The girl students are fewer having interest towards the practice of homeopathy. A few are lazy. They have used that one. They are married or some other. They are not showing. Why? Because they don't know the value of the doctors or how much fame and game we are getting. So most of the timings I have to given that one. Even you are no need to practice of homeopathy, but you have to use, you have to study it, you have to learn homeopathy for preserving your health. Tomorrow you will go to the somewhere you was treating in a wrong manner, the effects are facing you. So that's why you have to aware, you have to learn the principles for preserving your health self. No need to practice of homeopathy. Or at least you are not, many students are expressing, I don't have facility to practice of them. Yes, when you have a strong thought, ideology in our mind, very easy to practice. Why? Because so in the house only, you have to treat your husband, children, all other things. So through which you are propagated, you are inspiring your family, through which they are facilitating to practice. Or at least you have to give some neighbors. They are getting better result. They are suggested some, they are consulting somewhere other. You are providing through which say put to the others and to popularize the system of other things. So, and also in the IPD cases, as per criteria, we are not admitted. If you are admitted the cases and you are showing practically this thing. And also, many a times we are creating, certain people are running the case. If you are asking any question, I don't know. One man stated that 30 potency is good. Another man is stated that 200 potency is good. One man has given importance to the mentals. One man has, if you are asking
We have
me,
5 more minutes for you.
yeah,
Please
okay,
do
ma'am.
consider the
So
time.
you have to habituate, you have to learn each and every technique from the seniors or from the. So to fill up the page and to, if you want to provide a good doctors, so what I suggested is, so to each and everyone, there is no need to change much more. You have to do your work as a responsibility. Be confident, be trustworthy, be responsible towards the system of medicine and do your job, and you have to promote trustworthy and don't having selfishness and maintain transparency, maintenance of consistency, and accept your mistake and learn from the mistakes. You have to correct it, and then you are act like a, and you have to create. Even government has there provided certain facilities. We are not using those facilities. You are demanding few more. They are asking, first of all, you have to use it. When we have to use it, we have to create a demand in the public, automatically coming to that one. In the combinations, you don't use combinations. Why? What is the worried about preparing the pharmaceutical companies? You don't buy. You are not, you are strictly practicing the homeopathic principles. Everyone habituated by seeing you, and few more students are come along with you. Definitely we are creating a positive energy and positive vibe, and there is no need to create. So what I suggested is, there is no need to fill the gaps. Don't create the gap. So don't damage purity in that one. So you have to promote it and conduct a medical camps. What you have read, you have to show. Publicity is lacking. In all other medical profession, publicity is there. Even research articles are not come. Everywhere we have to go pharmacy tour, all like that. Where the institution was successfully running, you have to conduct a tourism like that. You want to show the results and automatically students are inspired and teachers are inspired and constructing one change is happening. NIH is there. More than 3,000 patients are there. In other states, what about you? Why not we are converted into NIH? So this type of positive energy was keeping in our mind. Definitely we have to that one. Okay, ma'am, is it over, ma'am? Yeah.
And thank you, sir, for that insightful session. And I'm sure that we have absorbed what you have said. All your points were clear cut. And now, due to shortage of time, we are moving on to our next delegate, Dr. Shweta Singh, researcher from CCRH. The stage is all yours, ma'am.
Thank you, Arya, and very well said, Dr. Karnakar. It's a very important and very apt questions. Are we producing doctors or merely degree holders? This is not a rhetorical question. It is an uncomfortable but a very necessary reflection on the current state of homeopathic education. Every year, thousands of students graduate with a recognized degree, yet a significant number hesitate to practice. So, why? Not because they lack intelligence or sincerity, but because they lack clinical confidence, I guess. There are many batchmates of mine who are the toppers in the class when I was in college, but I don't know any of them is practicing right now. So let me begin by stating something very clearly, that basic fundamental knowledge is non-negotiable. Theoretical knowledge forms the foundation of any system of medicine. Subjects like anatomy, physiology, pathology, and diagnostics are very essential, because if we do not know what is normal, we never get to understand what is abnormal. Without understanding the human body, disease expressions remain superficial observations. So it is worth remembering that Dr. Samuel Hahnemann was a doctor first, then he became a homeopath. He never rejected medical knowledge, he transcended it. So as homeopaths, we should be proud of ourselves. We should be proud of our pathy, because it goes beyond modern medical science. by addressing the dynamic individualistic nature of disease. Our identity basically lies in our homeopathic principles, in the subjects. The strength lies in the subject's organon, repertory, materia medica. And as a homeopath, we should be very well versed with these principles and the subjects, not just prescriptions. So, knowing philosophy alone does not make a clinician. So, the missing link is practical clinical exposure. Here lies I think, real concern. In many colleges today, the patient exposure is very insufficient. Teachers basically they struggle to translate theory into practical applications. There is no such structural, curriculum for live case discussions. Clinical postings often became very observational. It is not that participatory on the part of students. So as a result, our students graduate underconfident. Many of them turn to non-clinical fields, and many of them avoid practicing altogether. Not because of they are not interested, but because they have the fear of failure. So that clinical confidence does not come from theoretical qualifications alone. So in many of the colleges, we do not truly train. We just simply graduate. And case taking, as we know, it is an art. It's not a shortcut. It is not a mechanical process. It is an art. So a good homeopath should be a good listener. He should be unprejudiced. We have all read in Organon. We should be observant. We should have patience. We should be empathetic. But unfortunately, in today's generation, many students, I was also a professor, assistant professor in Organon, and I have seen the students just want to jump directly to remedy selection. They do not want to diagnose a case. They do not want to know how we form the totality. They just want to know what medicine you have given. So they bypass the case analysis in search of quick results. They have that mindset, which make them vulnerable to new shortcut methods. They want that formula-based prescribing. They want oversimplification of everything, of that deeply scientific art. So the truth remains, a good homeopath is not one who knows remedies, but one who knows our patient. So we need to acquire those skills. We have that skill mature only through sustained clinical practice or exposure, which we need in the college. And these schools, we have a lot of masters in the past. Homeopathy has always had different philosophies, learning from different schools. It is not new to have new schools, right? We have Dr. Kent, we have Dr. H.A. Roberts, Stuart Close, Dr. Bonning Hussain. Each followed their own approaches. They have different approaches, yet all shared respect for principles of homeopathy. They have their emphasis on the case analysis. They have committed to clinical results. So we too had schools of thoughts. What we are having in today's world era, but there were no shortcuts in homeopathy. We need to understand this, and there should be none now. And this rise of these finishing schools, a systematic, signal the emergence. This is not a trend. It is a signal of systemic gap. Basically, the students need these schools to just uh, polishing their knowledge, to enhance that clinical confidence, to improve their case taking skills. Sometimes these schools definitely connect theory with practice because they gave those students the clinical exposure through real patients. They teach through real patients, which is lacking in the colleges. They provide mentorship, which is lacking in the colleges when we study. They have structured case discussions, which is very much important for a clinician to know how practically we practice theory uh, accordingly. And there is a bridge between college and independent practice. So their purpose is not to replace colleges, but to complete the clinician, I guess. And this is the ideal balance we need. College basically provide theoretical foundation, philosophical clarity, scientific discipline, but what is lacking, which these finishing schools are providing: clinical confidence, practical exposure, skill development, professional readiness. So there's no harm if the college and the finishing school coexist, but there are certain boundaries which should be respected, and we should stop commercialization of education. We should avoid to dilute our classical principles. We should respect our Hahnemannian homeopathy. We should ensure finishing school strengthen, not distort our fundamental principles. At the same time, I would say colleges must evolve and introduce such type of structured live case discussions. They should increase the patient exposure and strengthen the clinical trainings. They should integrate theory with bedside learning. That is what I want to say. And our basically, as a physician, as a clinician, our goal is simple: to practice homeopathy effectively and obtain results for the recovery of our patient. Until colleges consistently produce clinical confident homeopathic physicians, and finishing school will remain a necessity, not a luxury. So let us stop debating who is right and instead ask what is best for our students, our profession, and our patients. Because in the end, homeopathy survives not on degrees, but on results, integrity, and our healed patients. And we should understand every case is different. In there, every case is different. We don't get everything in every case. We should get, as Dr. Karnokar sir said, we can get mental symptoms only in a case or physical symptoms only in the case. Sometimes we get only keynote symptoms. So we should not blindly follow one school. We should learn. We can learn anything in this life, but we should know how can we apply, what to apply in different case, individualization, I think. So just try and learn everything. Just join every school and see what is best for your patient. So learn from your mistakes, learn from your failures, because everything is your experience. You will go forward with your experience only, not by blindly following only one school. Just follow everything, but stick to the principles of homeopathy. Stick to Dr. Hahnemann's teachings. I just have to say this thing. Thank you.
Thank you, ma'am, for that insightful session. Again, it was quite relatable to me as a student. And thank you for your well wishes. And now we are moving on to the Vice President of Ifph, Dr. Shaji. So if you could.
Thank you, Miss Arya, homeopathy student, a very exception in our daily Zoom meetings. Rarely the students attend our seminars, our webinars. Dr. Ms. Arya is a very passionate student. I appreciate you, Arya, for joining us and even able and willing to moderate our sessions. Congratulations to you and thank you also. So,
Thank you, sir.
the topic today is very important because is there any gap? Is there a bridging gap? And I wish to say there is a gap for some doctors who pass our BHMS or MD exam, and for some there is no gap. Those who understand the basic principles and also the practicable approaches of the experienced doctors and understand the doctor's specific approach rather than some principles proclaimed by certain masters alone will not help us. Homeopathy is not only patient specific, it is doctor specific also. It is very important to understand because ours is a holistic system of medicine which is governed by non-linear science and not by the linear science as proclaimed by the dominant school of medicine, the allopathic system of medicine and the World Health Organization and the pharma companies. Their research studies for medicine is linear science based, that is the material science based, that is useful only for technological and engineering scientific development purposes. But to study a living organism, linear science is not at all sufficient, and that is one of the bridging gap. Then there is educational gap. The educational gap is coming from the mode of principle of vision of a teacher and the reality of a clinician. In the colleges, the teaching is made to understand the teachings of Hahnemann, the basic principles in the classical way, and prove which medicine is effective. But it comes to clinical practice, we are all practicing to fulfill the first aphorism of Dr. Hahnemann. The physician's high and only mission is to cure the sick.
To health.
The physician's high and only mission is to restore the sick to health, to cure as it is termed. So that is the primary objective set forward by Dr. Hahnemann himself. That is why he made the first aphorism in such a manner. So, see, Hahnemann developed the law of similes, identified the law of similes at the age of 35 in 1790. In 1796, after 6 more years, when he was 41 years, he proclaimed and delivered that idea to the world, communicated to the world. Then he lived only 47 more years. And within that 47 years, he modified the organon of medicine 6 times. So, if he was living for another 50 more years, how many times he might have modified our organon to make it more practical and applicable so that an average intellectual homeopathy doctor will be capable of bringing the maximal potentials in his capacity so that this system of medicine in a holistic scientific way can be most effectively applied based on a holistic perspective where not only patient specific but also doctor specific way. So that doctor specific is a big thing that we need to understand, and that also help us realize that each doctor need to become his own philosopher and his own approach, develop his or her own approach. Then only he can be successful as a holistic homeopathic practitioner. So this philosophy is often neglected. Each one doctor who teaches us is telling we should develop certain patterns. So if 10 students will be given single patient, all of you how to arrive at the single medicine, same medicine is not always possible. Because a doctor is curing a patient not with the medicine alone. The connectivity, the energy connectivity between the vital force of the doctor with the weakened vital force of the patient is one way of cure. That is why the doctor should have a purity of mind, body, and soul. That is number one. Then the trust of the patient in the doctor is the next cure. Some the patients simply near to the doctor, they are okay. That they others call it as a placebo effect. That really true, and that is scientific also, and that not only exists with the homeopathy, that exists with every system of medicine. So that is not a negligible thing. Then the philosophy of the mind of the doctor to convince and understand the unnatural, unhealthy thought process that exists, unnatural, unhealthy concept and attitudes that lead to unnatural thought process, that is the biggest influencer of our vital force, our thoughts. And that is very important in Sora, especially nowadays we are living in a corrupted world. Those who control the world are corrupting our mind with unnatural, unhealthy philosophies that corrupt our mind, and we are living with the corrupted mind, with the wrong, unnatural, unhealthy thought process in our mind that itself is creating damage to our vital force. And that's why in recent past, so many new diseases like cancers and so many other new and new autoimmune disease and lifestyle disorders are developing for which conventional system of medicine has no treatment at all. Only holistic treatment systems of medicine can manage such cases. So all these are our bigger scopes, but are we understanding that? This is another gap. So we need to fill all these gaps. So the finishing schools, it's highly needed, and the intention and purpose of these finishing schools are understand the different gaps that exist today in homeopathic system of medicine. When we produce doctors to be the most competent, capable, and credible doctors to fulfill the and maximize potentials, to bring the maximum potential of homeopathy, to make homeopathy the number one system of medicine in the world, so that we can have the second mission given to us by Hanuman. That is the highest ideal cure is rapid, gentle, permanent restoration of health, or removal and annihilation of the disease in its whole extent in the shortest, most reliable, and most harmless way, meaning on an easily comprehensible principles. So the second aphorism is also important, but we can achieve it provided we understand the gaps that exist between the academic vision and the reality in a clinical mission. So the unfilled mission of bringing homeopathy to the number one system as the number one system in of the world is still to be fulfilled, and we need to carry the continuation of Dr. Hanuman in furthering organon, in filling the gap and adding more clarity to our philosophical approach and practical approach, so that so many experienced doctors are giving so many approaches to us. So each one of us, based on our philosophical understanding and vision and mission, need to take into consideration our own practicality so that we can fulfill our own abilities in the best possible way. So that is the need of the finishing school, to make each one of us understand that mission. So then the scientific furtherance. So the researches we conducted in homeopathy also are governed by the WHO guidelines that is nothing but a pharmaceutical, commercial, material science based methodologies, that's not suitable to us. But guided by our CCRH onwards, we are also guided our researchers to conduct research methodologies in such a manner that not really suit our purpose of bringing the maximized potential of effectiveness of homeopathy in a holistic manner. So our CCRH has to deliver a big message that it is not the RCTs are not our way of medical research. That is to produce a commercially competent product they can sell in the market for many people with the same disease. Ours is individualistic. So our clinical researches should be not RCTs. It is patient specific. So ours is what it is called. There is a term, I forgot that term. It is, sorry, I will tell it on the way. I forget that word. That is, we usually bring out our studies of each individual. There is a name, I forget that, sorry. So we need to bring such researches as suitable to holistic systems of medicine, not RCTs. So these are the realities, and we need to understand and we need to proclaim that to the world, because India has a special responsibility for that. Because India is the only country where, other than health ministry, which is controlled by the conventional allopathic system of medicine, there is an Ayush ministry where all Ayush systems of medicines are holistic systems of medicine. And this philosophy applied to all holistic systems of medicine. So the RCTs are never suitable to any holistic systems of medicine. So we in India, our Ministry of Ayush has the responsibility to modify the research methodology from RCTs to individualized methodologies. I still forget that name. Sorry for that. I think I will be able to remember that and tell you before I finish today. So anyway, so need for furtherance of science is very important, from material linear science to holistic non-linear science. Then classical to practical approaches by given by the experienced doctors who treat 300-400 patients a day. They were able to produce good results. That's why patients queue up in their clinic. They are using only homeopathic medicine. So there are practical ways to approach patients slightly different from where Hahnemann applied, especially in acute and chronic cases. If that is working, there is a science behind it. We need to understand it scientifically and incorporate with the meaningful ways to in our finishing schools, not in our BHMS curriculum. BHMS curriculum should be exclusively to understand the fundamentals. And finishing schools are needed for understanding these variables and gaps, so that each doctor has to become doctor-specific oriented, which is the scientific way in any holistic systems of medicine. And there are different dispensing approaches also. There are multitudes of possibilities as we go forward. So our mind should be kept open, so that anything that is helping the furtherance of homeopathy to make it the number one system of medicine in the world, so that the potentials and possibilities of homeopathy will be able to give to the ordinary people, unhealthy people, by an average intellectual homeopathy doctor in the best way possible. That should be our mission. And that should be the mission of finishing schools. and that is highly needed. And I appreciate these talks I am listening last 3 4 days will help CCRH and NCH and homeopathic world around the passionate homeopathy doctors around the world will understand this and able to produce best quality doctors in the world, homeopathy doctors in the world, so that homeopathy become the number one system of medicine, and the people around every nook and corner of the world will be enjoying the potentials of homeopathy in the near future. Thank you very much.
Thank you very much, sir. I guess that was an incredible session. Thank you. And I'd like to add a few points from myself as a student, as someone who is new to this field. So, just a few words from my part. When I joined in this college, I wasn't aware of anything at all, like any other student with no background in homeopathy. And slowly I started to realize the effects that it had on my own health, how it cured my allergies and some homesicknesses and mental symptoms I had. That also was cured. And I I was so interested in homeopathy, and finally I found IFPH. Even though I find it sad to say that even my family members, some of them, have said that you're wasting time by going for these seminars and going here and there instead of focusing on your theory. You're going here and there. They always complain like that. They say these things to my parents also. But here, when I said these to my teachers, they were surprised that it's not just me. There are few more students from my college who participate in these webinars daily. And I must say that I have got a clear picture of how it is to deal with cases rather than sitting here in the OP or visiting patients in the IP. I could feel that it has gone to an international level of all the cases that we are discussing here. The way they make us feel that materia medica and organon are actually interconnected. They are not just different subjects. It's like two legs of homeopathy. And also I'd like to thank sincere thanks from my part to the coordinators of IFPH for giving us such a wonderful platform to know more about homeopathy. This makes us curious about homeopathy. Wherever I go, if I find someone curious about homeopathy, I'll explain to them. I'll tell them we have a channel, and wherever we go, I find books on homeopathy. I will buy books on homeopathy. And I've also shared this channel to my classroom group. They were also very surprised to see that we have such a forum like this, and it's really a milestone that we have concluded 2000. We are about to conclude 2000 webinars, and that too we have 3 sessions per day. So actually, to all the coordinators is my big thanks. Thank you, sir.
It's a
Thanks a
very
lot.
incredible job. It is the passionate doctor, homeopathy doctors of the entire world is with IFPH. That's why it is
Yes,
existing.
yes,
So
sir.
we all are cream of homeopaths around the world, and we are proud about it. That's why it is
Yes,
Okay,
running.
sir.
We are not working. We are volunteers.
we are
We are
volunteers.
nothing. We are losing from our see Dr.
Yes, sir.
Ganesh. See him.
Yes,
We all.
Yes,
yes,
sir.
sir.
We don't actually expect any profit from this, but I must say that it's becoming a golden chance for all the students of homeopathy, not just students, for the well-wishers. If anyone asks me if homeopathy has no effects, something like that, the common men have not, till now, they have not understood the concept of homeopathy. They simply say that if the sweet pills are good for children, there is no side effects, there is no effect at all. So when they tell such things to me, I show them these webinars, and then I'll keep them shut.
I would like to add, thank you, Dr. Miss Arya, to add something like this. We are really proud of you because you are the next generation doctor to flourish homeopathy, to take homeopathy to new heights. Anyway, it
Thank
was
you.
really an excellent session. I would like to add some points here because
Yes, sir. Yes, sir.
what's the need of this bridging school? Let me say a few things. When I just passed out from homeopathic medical, I have no confidence in practicing because I have never seen a single case cured with the homeopathic medicine, single remedy, when it was I was in the college. But when after coming back to home, I have a good friend, just senior. He was just Dr. Dilip, who was just senior to me. He was practicing very some 6 kilometers away from my home. He called me and told me that you simply come over here. When I reached there, what I found that lot of patients are waiting in front of him with and after sitting there, most of the patients coming in and saying that, oh, doctor, I'm very much happy that I have cured this case. I have very much improvement like that. That means almost every case, only very few cases were not responding to his medicine, but most of the cases were responding positively. That make me to think why I can't become such a doctor. When can become such a doctor? How I can become? Because what I found that he was sitting in the clinic and simply when a patient come over, he just take a book and like this, and then he open the page and then just read like this, and then he refer this, and then he give the medicine. He never look at the patients, always at him, but instead he refer. Then some people may do what the others may think like this. Oh, this doctor is actually he is referring. That is the way a homeopathic doctor shall be and should be and must be. Because he one when you get a case in front of you, you just study the case, make it sure that the medicine when you study the medicine, when you make sure that the medicine you are giving to the patient is the absolute simillimum rather than simply a partial simillimum. That's what he was doing. But I couldn't ask I never asked a question to him because I have no such ideas what he's doing. So if he has a very good impression on me, but I have no confidence in homeopathy. But gradually I found that within 1 month he got government service. Then he asked me to sit in the clinic with so much patients. I was really in a dilemma. What I did was just give placebos to the patients for the time being and then wait. Then, frankly, the patients get very good improvement. So that then what? Then I move from that to medicine. Then how I move? That's a very important question. That means that, uh, as you know, we used to say, "I am a doctor." Yes, what is the meaning of a doctor? A doctor means a good teacher. So what I have done in that clinic is I started teaching each and every patient what is his problem, how it comes, how it can be, what can be the possibilities. Just like once I started explaining to them, they have a good belief in me. They have the confidence. They find another different type of doctor in that same clinic improvement. So that's what I would like to add. That a physician, a clinician must be a good teacher. That's the reason why when people are completing PhD, they are giving doctorate. So that he's an authority to speak on a particular subject. Like that, we homeopaths are supposed to be the faculty, just like people who is an authority. That's what Dr. Hanuman in his lecture said, that each and every homeopath is an authority. No, the government DMO or CMO or director or the national chairman. It is not the authority. You yourself is an authority because you studied everything. You are implementing your knowledge. You are consulting a patient. You are delivering your medicine. You are getting cure. And then what you are doing is the institutional treatment. That's what required. So I would like to add one more point. I have seen that lot of junior doctors were struggling in Kerala. But in that time, one of my friends started a finishing school named Sakya. But actually, people thought that it is for making
Dr.
money. But
Biju,
actually, it
I
was.
guess.
Yes,
Yes,
I didn't
yes,
mention the name because that's
yes.
that's not the, because of that's the reason why he started that thing, and a lot of junior doctors got training there. But what he has done there is that he just explained whatever good thing he get from his knowledge, as well as he brought a lot of practicing doctors there. They also teach the junior doctors. And then thereafter, what happened was really an entirely different doctors. Even we know that the doctors are they are not having the ability to communicate with the people. That is that's kind of strange fate is the first thing he removed from the doctors. That is what we require. This is not happening in our colleges. This is this kind of motivation as well as personality training need to be given to the students. Then only when they came out from the college, they will become good communicators, and they are able to when they become good communicators, they now become good doctors because they have all the knowledges with them. But unfortunately, we are not utilizing. This is what I would like to add to the session. Thank
Just a
you,
minute.
Dr. Shah.
Just a
Yes,
minute.
yes.
So the one thing I forgot is
One
case
minute.
studies.
I just want to complete. Thank you, Dr. Karnagar, as well as Dr. Shweta Singh. All your discussions were really excellent. Hope all of you will join us tomorrow because we are celebrating the 2000 day of IABH webinars. We need to continue this kind of webinars because we can sit together, work together to take homeopathy to new heights. That's what the purpose of this international forum for promoting homeopathy. Not simply make sure that homeopathy will be the number one in the coming days. Thank you.
Just 1 second. What the name I forgot regarding research studies, case studies. The homeopathy is patient specific, and case studies should be our methodology for research, not RCTs. Case study is the name I forgot. So case studies which are individualized studies should be the norm of holistic systems of research studies, not RCTs. RCTs can be also done, but it will not bring out the maximum potential of our system. That's all. Thank you.
Thank you, sir. Thank you, Dr. Dinesh, sir. Thank you, everyone who has participated. Thank you to all the delegates. And I'm going to conclude this session since we are out of time and the Malayalam session needs to start. Thank you, everyone. Good night.